One bad habit is wrecking your sleep and raising your stroke risk from blood clots overnight. And if you're not careful, you could end up having a stroke before you even realize what's happening. That's why in today's video, I want to share with you my top tips on how to avoid this silent killer while you sleep, so you can wake up feeling energized and ready to seize the day. Let's dive in. I'm a board-certified and fellowship-trained vascular neurologist. And on this channel, I help you avoid a stroke or other vascular accident, like a TIA or a brain hemorrhage, by making simple changes to your lifestyle. So if that sounds like something you're interested in, make sure you subscribe. Now let's talk about what's really causing these clots at night. We know that as we age, our blood vessels stiffen, and our blood also becomes thicker and more likely to clot. Combine that with longer hours of inactivity during sleep, and you have the perfect recipe for trouble. But here's where things get really interesting. Recent studies have uncovered one common nighttime habit that makes this problem much worse. And it all has to do with your breathing. You see, when you breathe, your diaphragm, which is this large dome-shaped muscle in your chest, moves up and down. This action alone helps pump blood through your body. It acts like a second heart. In fact, every time you inhale, your blood pressure rises slightly, helping to push blood from your heart into your arteries and around your body. Now, this may seem like a small thing, but it's actually incredibly important for maintaining good blood flow, especially in people who have certain risk factors for blood clots. In addition to that, when you breathe, you're also taking in oxygen, which helps keep your blood from clotting. Oxygen is like an anti-clotting agent that keeps things moving smoothly. On the other hand, when you hold your breath or don't breathe deeply, the opposite happens. Your blood becomes thicker and more likely to clot. That's because when you're not breathing properly, you're not getting enough oxygen, which can cause your blood to become more viscous or thick. And you'll have less nitric oxide, which is a molecule that actually prevents clots. So what does this mean for you? Well, if you have a habit of holding your breath or not breathing deeply at night, you're putting yourself at increased risk of developing clots. And believe it or not, this is actually very common. Many people unconsciously hold their breath or shallow breathe at night without even realizing it. Some do it because they have sleep apnea. Sleep apnea is a condition where you stop breathing during sleep, usually because the throat closes off. Then you have something called upper airway resistance syndrome. This is a fancy term for having a partially blocked nose. It could be from allergies, a deviated septum, enlarged adenoids, or even a simple runny nose. Then there's something called Cheyne-Stokes respiration, which is a pattern of abnormal breathing that happens when your lungs aren't working properly because of a condition like COPD or congestive heart failure. Lastly, many seniors simply develop poor breathing habits over time due to poor posture or being in bed for long periods. Now the question you might be asking is, how do I know if I have this problem? Well, I'm glad you asked. There are a few telltale signs that can help you figure out if you need to pay closer attention to your breathing. First, you may notice that you snore loudly, especially if it's a dry or hacking sound. That could indicate that your upper airways are blocked, causing you to breathe through your mouth and put more strain on your diaphragm. Second, you may have persistent hiccups, especially if they happen right before bed or upon waking. Hiccups are involuntary contractions of the diaphragm that can be triggered by poor breathing or other factors. Third, you may have excessive daytime sleepiness. If you're not getting enough oxygen at night, it can lead to fragmented and lower quality sleep, leaving you feeling exhausted during the day. Finally, you may have morning headaches, especially if it's behind your eye or in the cluster. Morning headaches are often caused by poor blood flow during sleep and the resulting lack of oxygen. If you relate to any of these symptoms, it might be time to take a closer look at your breathing habits. Now you might be wondering, what's the big deal about breathing? Isn't it just air going in and out of my lungs? Well, no, my friend. Breathing is like the rhythm of life itself. When you breathe, you're not just taking in oxygen. You're also exhaling carbon dioxide, which is a waste product that your body doesn't need. In fact, every time you exhale, you're helping to remove harmful toxins from your body and make room for more oxygen. And let us not forget about the power of deep breathing to calm your mind and relax your body. When you take deep breaths, you're activating the parasympathetic nervous system, which is like the chill mode of your autonomic nervous system. This can help reduce stress, lower blood pressure, and promote overall relaxation. Plus, deep breathing can help improve your sleep quality and make you feel more refreshed when you wake up. The key to avoiding nighttime clots is to keep your blood flowing smoothly and to prevent it from becoming too thick. And guess what? Breathing plays a crucial role in keeping things moving along. When you breathe deeply and regularly, you're helping to pump blood throughout your body and prevent it from pooling in one area. This helps to reduce the risk of clots forming and allows oxygen to reach all parts of your body, including your brain. But it's not just about breathing during sleep. It's equally important to maintain good breathing habits during the day. If you spend most of your day sitting or lying down, it's easy for your blood to pool in your legs or other parts of your body and increase your risk of clots. So make an effort to get up and move around every half hour or so. Especially if you're not able to walk, try seated exercises like marching in place or simply rotating your ankles. These activities can help keep your blood circulating and reduce your risk of developing clots. And let's not forget about the importance of hydration. Drinking plenty of water throughout the day can help keep your blood from becoming too thick and reduce the risk of clots. Aim to drink at least 8 cups of water per day and carry a water bottle with you as a reminder. By following these simple tips, you can help keep your blood flowing smoothly and reduce your risk of developing dangerous clots. And now for the grand finale. I'm going to share with you the No. 1 tip for improving your breathing. Are you ready for it? It's simple yet powerful. Just start paying attention to your breathing throughout the day. Yes, I know it sounds basic, but most people have no idea how they breathe until it's brought to their attention. Once you start paying attention, you can consciously make changes to improve your breathing habits and reduce your risk of nighttime clots. For example, try setting an alarm on your phone to remind you to take a few deep breaths every half hour. You can also practice deep breathing exercises for a few minutes each day to help strengthen your diaphragm and improve your overall breathing. And don't forget about the importance of addressing any underlying issues that may be contributing to poor breathing, such as allergies, sinus infections, or sleep apnea. With a little effort and attention, you can improve your breathing habits and reduce your risk of nighttime clots. As a side note, there are some medications that can also help improve blood flow and reduce the risk of clots. For example, baby aspirin can help thin the blood and make it less likely to clot. However, it's important to talk to your doctor before taking any medication, including over-the-counter drugs like aspirin. Your doctor will consider your individual health situation and advise you on the best course of action. Now I want to hear from you. Have you ever experienced shortness of breath or other breathing problems at night? If so, what did you do to manage it? For many years, we have been told that fat around the belly is bad for our health. This has led many people to start extreme dieting and workout routines with the goal of removing the belly fat so they can be healthier. But according to research, it may actually be a protective measure against strokes. In 2018, a group of scientists from China conducted a study looking at over 10,000 adults. They measured their waists and monitored their health for 7 years. During this time, there were 457 cases of stroke. They found that those who had a larger waist size had a lower risk of stroke. One of the researchers, Dr. Gang, he says this could be because the fat cells in the subcutaneous layer of the belly can absorb some potentially harmful substances in the blood, including triglycerides thereby reducing the risk of cardiovascular disease. However, he says more research is needed to confirm these findings. So until then, should you start working out less and eating more with the goal of increasing your waist size? Well, it would certainly be unwise to do this if you are already overweight. Weight loss surgery patients typically have an increase in their waist-to-hip ratio, which predicts negative outcomes. In fact, excess weight around the midsection is a known risk factor for heart attack and stroke. Studies also show that visceral fat, which is belly fat that surrounds internal organs, causes chronic inflammation and increases the risk of cardiovascular diseases. So while it might not be a bad thing to have some extra padding on your midsection, being obese still comes with a number of risks. It is important to keep this in mind when looking at this new research. While we wait for more studies on the topic, maintain a healthy lifestyle with a balanced diet and regular physical activity. Using a smartphone while walking. Who hasn't done this before? We use our phones as a map while traveling and even while driving. And if we're going somewhere close by, many of us will pull out our phone and text someone instead of walking into the next room. But according to a recent study, this may be deadly. A study from China involving 10,000 people found that those who used their mobile devices while walking were 44% more likely to have a stroke or cardiovascular event. Researchers say that people who use their phone while walking tend to walk slower and put one foot in front of the other without paying attention to their surroundings. This creates a domino effect, causing them to trip, fall, and hit their head. This sudden impact can lead to a stroke. The lead author of the study, Dr. Meng Wang, suggests that people should be more aware of the potential dangers of texting while walking. Our findings suggest that both falls and the use of mobile phones during walking may be potentially modifiable risk factors for stroke, she said. However, some experts disagree with these findings. Dr. Thomas Shorstein, a neurologist at the Boston University School of Medicine, says there are other possible explanations for why people who use their phones while walking are at increased risk for stroke. For example, they may be distracted and not paying attention to what they're doing, which can cause them to make unhealthy food choices. They may also be indoors instead of outside where they can get exercise, or they may live farther away from stores, meaning they drive everywhere, which increases their risk of heart disease. Dr. Schornstein insists that more research is needed to determine whether using a smartphone while walking actually causes a stroke or merely correlates with one. Until then, please be mindful of your surroundings when using your phone. Number 3, staying up late. According to research, people who stay up late are at increased risk of heart disease and stroke. Researchers looked at nearly 200,000 adults in Japan and found that those who went to bed between 11 p.m. and midnight were 29% more likely to suffer a stroke or heart attack. Those who stayed up until 2 a.m. were 42% more likely to experience a cardiovascular event. But why does staying up late have such a huge impact? The reason, according to the study, is sleep deprivation. People who stay up late often don't get enough sleep, which increases the production of adrenaline and noradrenaline hormones that regulate blood pressure. When you don't sleep enough, your body becomes overloaded with these stress hormones, which raises your blood pressure and makes your arteries stiff. This increases your risk of heart disease and stroke. Dr. Hisashi Takaya, lead author of the study, recommends keeping a regular sleep schedule. Our findings suggest that maintaining a regular sleep schedule may be important for preventing cardiovascular disease, he said. If you struggle with insomnia, consult with your doctor. 4. Drinking coffee late in the day. Coffee lovers can rejoice. Despite the many benefits of giving up coffee, like improved sleep quality and decreased anxiety, research suggests that those who drink 1 cup of joe in the afternoon have a 12% lower risk of developing Parkinson's disease. What's going on here? A large study from South America looked at 29,000 people over the course of 6 years. A found that those who drank 1 or 2 cups of caffeinated coffee in the afternoon had a significantly lower risk of developing Parkinson's disease. Now, coffee drinkers should not take this as an excuse to drink unlimited amounts of coffee. Experts warn that too much caffeine intake can be dangerous, leading to symptoms like anxiety, irritability, and tremors. Still, this should be good news for those who enjoy an afternoon pick-me-up. No. 5. Having a plan B. There's a saying that goes, Plan A is to work hard and smart. Plan B is not to quit. This quote by unknown author is the motto of those who succeed at life. According to research, people who have a backup plan or fallback option are more likely to give up when faced with failure. Why? Because they think, no worries, I can always count on my plan B. As a result, they become complacent and don't put in the necessary effort to make their primary plan successful. This was demonstrated in a study by psychologists from Harvard University. They divided volunteers into 2 groups, giving each a challenging task to complete. The first group was told they would receive $10 for completing the task. The second group was told they would receive $10 only if they managed to finish the task within a certain time frame. The rest of the participants were given Plan B, which guaranteed them $5, regardless of how long it took them to finish the task. What they found was that those who didn't have a backup plan worked harder and faster to complete the task. On average, they finished it in 63 minutes compared to the 85 minutes it took the other group. Clinical psychologist Dr. Andy Mlinsky believes that having a backup plan makes people overconfident, which lowers their performance. As human beings, we have a tendency to underutilize options we have available to us, particularly when they're good options, he said. The takeaway? Don't have a plan B, because it will only hinder your ability to succeed with plan A. No. 6. Eating too much garlic. Garlic is a tasty ingredient that can be added to almost any recipe to give it a unique flavor. But despite its many benefits, too much garlic can be bad for your health. According to a recent study from Taiwan, people who consume more than 2 cloves of raw garlic per day have an increased risk of bleeding in the brain. Researchers examined 10,000 adults and found that those who ate the most garlic were 75% more likely to suffer from a brain hemorrhage. But why does this happen? Garlic contains a substance called allicin, which gives it its pungent odor and flavor. Allicin is considered good for the body in small doses, but too much of it can thin the blood and lead to bleeding in the brain. Dr. Pojin Sung, lead author of the study, recommends limiting garlic consumption. People who want to eat garlic should cook it to avoid adverse effects, he said. Before consuming large amounts of garlic, talk to your doctor. And no. 7. Drinking water too fast. Imagine this. You haven't had anything to drink for hours, so as soon as you grab a glass of water, you chug it down in one gulp. According to research, this can be bad for your health. In a study published in the Journal of the American Heart Association, scientists from the United Kingdom examined 100,000 people. They found that those who drank their water quickly were 21% more likely to have a stroke or cardiovascular event. But why does drinking water too fast increase the risk of stroke? Chugging down large amounts of water quickly lowers sodium levels in the blood. This sudden drop in sodium levels triggers a condition called hypovolemic stroke, which occurs when there is not enough blood volume to supply oxygen to the brain. This can lead to dizziness, confusion, and in severe cases, a stroke. Dr. Kayode Akinbola, senior lecturer at the University of Cambridge and co-author of the study, recommends drinking fluids throughout the day. These findings support existing guidelines to drink fluids regularly through the day rather than chugging large volumes in one go, he said. All right, so the third hidden danger is salt. You know that little salt shaker on your dinner table? Yeah, that little guy can be dangerous if used improperly. Now I know you're probably thinking to yourself right now, Doctor, come on, how dangerous could salt be? I put salt on my food every single day. But there's a reason why they call it the salt lick. It's because animals will literally lick rocks and soil just to get their salt. You see, our bodies need a certain amount of salt to survive. Too little or too much can throw off the delicate balance of chemicals and fluids in our body, including the amount of water in our cells. And this leads us to dehydration. Many seniors tend to drink less water throughout the day to avoid having to wake up at night to urinate. In fact, studies show that up to 66% of elderly patients are chronically dehydrated. Now, when you think of dehydration, you may picture someone out on a hot summer day playing sports and forgetting to take water breaks. But dehydration can happen even when you don't realize it. And the reason is because as we age, the sensation of thirst goes away and it becomes harder for us to recognize when we need to drink. Our kidneys also lose the ability to concentrate urine, which means we have to pee more frequently than younger people. The problem is many seniors hold on to their water during the day to avoid nighttime urination. By doing this, they're putting themselves at risk for all sorts of health problems, especially blood clots. You see, dehydration thickens the blood, making it more likely that clots can form and travel through the body. Studies show that even mild dehydration can raise DVT risks by as much as 400. That is a 4 times increased risk just from being mildly dehydrated. And what is even scarier is that a study done in 2012 found that 66% of elderly patients in hospitals were mildly dehydrated. And this is especially dangerous at night when people sleep. That's because when you sleep, your blood pressure drops and the blood vessels relax, which makes it easier for clots to move around. If a clot breaks loose from its hiding spot in the leg and travels to the brain, it can cause a stroke. Some studies show that up to 18% of strokes happen while a person is sleeping. And this is particularly devastating because you may not realize anything is wrong until the next morning when it is too late. One way that hospitals try to combat this problem is by giving patients water intravenously. But studies show that sometimes even 4 fluids aren't enough to keep the blood from clotting. So what should you do to protect yourself from this silent threat? Well, first things first, make sure you're eating the right foods. Eating salty foods like chips and pretzels, canned soups and frozen meals can increase the amount of sodium in your body, which can lead to dehydration. To make matters worse, these foods are often high in saturated and trans fats, which can make your blood thicker and more likely to clot. On top of that, they don't really fill you up, which can cause you to overeat and gain weight. And we all know that excess weight places added stress on your heart and blood vessels. Instead, try to stick to foods that are naturally low in sodium and fat, like fruits, vegetables, and whole grains. For example, a recent study actually concluded that eating 2 servings of fish per week may lower your risk of getting blood clots by 18%. That's great news for those of us who love seafood. Also, nuts and seeds can be a good source of healthy fats and protein without the extra sodium. And don't forget about beans, low-fat dairy, and soy products. They're all great options too. But remember, portion control is still important. Just because something is healthy doesn't mean you should eat a lot of it. Next, you need to watch your fluid intake. Staying hydrated is key to preventing blood clots, but you don't want to overdo it. Drinking too much water can actually dilute the sodium in your blood, which can lead to other health problems like headaches, nausea, and confusion. So make sure you're drinking just enough to stay hydrated without overdoing it. A good rule of thumb is to drink when you're thirsty and stop when you're full. But if you're concerned about how much water you should be drinking, ask your doctor for advice. Finally, make sure you get moving after you eat. When you eat, your body works hard to digest that food, and that requires a lot of fluids. Unfortunately, when you lie down, your body can't circulate those fluids as easily. As a result, you're more likely to feel bloated and uncomfortable. You're also more likely to have acid reflux and other digestive problems. But if you get up and move around after you eat, You can help your body move those fluids where they need to go. Plus, exercise can help reduce your risk of blood clots in general by increasing circulation and promoting healthy blood flow. Aim for at least 30 minutes of moderate exercise most days of the week. That could be anything from brisk walking to cycling. Just make sure you talk to your doctor first if you have any concerns. And here's an interesting fact. Did you know that deep vein thrombosis, also known as a blood clot, is one of the leading causes of preventable hospital readmissions? Yeah, it's true. And that is because many patients do and know the warning signs of a blood clot after being discharged from the hospital. So if you or a loved one has recently been discharged from the hospital, it's important to be aware of the possible signs of a blood clot. These can include swelling, redness, or warmth in the affected leg, as well as shortness of breath, fatigue, anxiety, discolored skin, changes in blood pressure, and excessive sweating. If you notice any of these symptoms, seek medical attention immediately. Early diagnosis and treatment can prevent serious complications, such as a pulmonary embolism, which occurs when a blood clot travels to the lungs. Now, what about taking medicine? Well, believe it or not, some medications can increase your risk of developing blood clots. These include birth control pills and hormone replacement therapy. If you're currently taking either of these medications, talk to your doctor about the risks and benefits. There are alternatives available that may be safer for you. And if you have a personal or family history of blood clots, your doctor may recommend that you take blood thinners regularly. Blood thinners can help prevent clots from forming in the first place, which can be especially helpful if you're at high risk. But it's important to remember that blood thinners do come with their own set of risks, including an increased risk of bleeding. So you need to weigh the pros and cons with your doctor and decide what is best for you. All right, here's another question I get asked all the time. Can massage guns help prevent blood clots? Well, the jury is still out on this one. Some small studies have suggested that massage guns may help improve circulation and reduce the risk of blood clots. However, more research is needed to confirm these findings. If you already have a massage gun, there is no harm in trying it out and seeing if it helps you relax and improve your circulation. But don't rely on it as a substitute for medical treatment. That brings up a great point. This entire video has been about prevention. We haven't even talked about what to do if you actually have a blood clot. And the truth is, treatment depends on the underlying cause and the severity of your symptoms. Some blood clots are small and don't cause any major problems, so they can be monitored with regular checkups. Others are larger or located in areas that could be life-threatening, and those require immediate medical attention. Treatment options include blood thinners, clot busters, compression stockings, and even surgery. Again, it all depends on your individual situation. So there you have it, the hidden dangers of salt, dehydration, and nighttime leg cramps. I'm going to share my best tips for lowering your stroke risk overnight. And these are the exact steps that my patients follow to reduce their chances of having a stroke. So please watch carefully. And if you're new here, make sure you hit the subscribe button so you don't miss any important health tips. Also, please tap the like button because it helps others find this video. Now, for those of you who haven't watched part 1 through 3, I strongly encourage you to do so, as they contain crucial information about stroke prevention. In part 1, I explained the one cause of strokes that most doctors fail to mention. In part 2, I revealed how to fix a faulty heart valve that can lead to a stroke. And in part 3, I shared 5 simple warning habits that can lower your stroke risk by 80%. Make sure you check them out after this video. So let's jump right into the first tip. Tip number 1. Eat dinner at least 3 hours before bedtime. Now, you may be thinking, why does it matter when I have dinner? Well, it matters a lot. You see, when you eat a meal, your body works hard to digest that food and send the nutrients into your bloodstream. This process requires a lot of energy. And if you eat too close to bedtime, it can disrupt your sleep. When your body is busy working on digestion, it can be harder to fall asleep and stay asleep. And we all know that a good night's sleep is essential for our overall health, especially when it comes to preventing strokes. Several studies have found that people who regularly eat dinner early and breakfast late have a much lower risk of stroke than those who eat late at night. A study published in the Journal of Nutrition, for example, found that eating the last meal of the day 3 hours before bedtime was associated with a 21% lower risk of stroke. Another study published in the American Journal of Clinical Nutrition found that eating dinner earlier in the evening was associated with a lower risk of cardiovascular disease and stroke. So make sure to finish your dinner at least 3 hours before bedtime to allow your body enough time to digest the food and prepare for a peaceful night's sleep. Tip number 2. Avoid heavy, salty, or sugary foods late at night. Now, you may be wondering why you should pay attention to what you eat at night. Shouldn't all calories count the same? Well, not exactly. See, eating heavy, salty, or sugary foods too close to bedtime can cause blood sugar levels to spike. That spike in blood sugar levels can cause your body to release more insulin, which is a hormone that helps regulate blood sugar. High levels of insulin can cause blood vessels to relax, which can lead to fluid retention and increased blood pressure. Over time, this can damage the lining of blood vessels and make them more susceptible to plaque buildup, which increases the risk of stroke. Additionally, eating salty foods late at night can cause dehydration, which can also increase your risk of stroke. Dehydration makes your blood thicker, which makes it harder for blood to flow through your arteries. When your blood is thicker, even a small blockage can cause a stroke. Now I understand that sometimes we just can't help it. We eat salty foods or have a sweet tooth. But try to be mindful of how these foods can affect your body and make an effort to avoid them late at night. Instead, opt for healthier snacks such as fruits, vegetables, or nuts if you're hungry. These snacks will not only help you avoid the risks of eating salty or sugary foods, but they will also provide your body with essential nutrients that promote better sleep. Now, some of you might be thinking, how late is too late? When should I stop eating at night? Well, there's no one-size-fits-all answer to this question, as it depends on factors like your age, lifestyle, and overall health. However, as a general rule of thumb, it's best to avoid eating 2 to 3 hours before bedtime. During this time, your body produces less digestive acid, which means that it's harder to digest food. Additionally, eating too late at night can disrupt your sleep schedule and leave you feeling unrefreshed in the morning. So try to establish a regular eating schedule and stick to it as much as possible. This will help your body adjust to a consistent rhythm and improve your overall health. Remember, making small changes like these can have a big impact on your long-term health and well-being. So don't underestimate the power of avoiding heavy, salty, or sugary foods late at night. Tip number 3. Take a 10-minute walk after dinner. Now, I know it might seem counterintuitive, but staying active can actually help you sleep better at night. Exercise can help reduce stress and tension, which can make it easier to fall asleep and stay asleep. It also helps regulate your body's internal clock, which controls sleep-wake cycles. Plus, exercise increases blood flow, which can promote relaxation and reduce the risk of blood clots, which can lead to strokes. Now, I know it might be tempting to kick back and relax after a meal, but try to resist that urge and go for a 10-minute walk instead. Even if you can't fit in a full 10 minutes, even just a few minutes of walking can still be beneficial. Just make sure to consult with your doctor before starting any new exercise routine, especially if you have any underlying health conditions. Tip number 4. Stay hydrated throughout the day, not just before bed. Drinking enough water during the day can help your body maintain healthy blood pressure, which reduces the risk of stroke. Water naturally thins the blood, which improves circulation and reduces the risk of blood clots. It also helps transport nutrients and oxygen to the brain, which is crucial for maintaining cognitive function and preventing dementia. Now, I know we often hear about the importance of drinking water, but we usually focus on doing it during the day. However, it's equally important to drink enough water at night as well. If you don't drink enough water before bed, your body will be dehydrated, which can increase your risk of stroke. Dehydration makes your blood thicker, which makes it harder for blood to flow through your arteries. When your blood is thicker, even a small blockage can cause a stroke. So make sure to drink at least 8 cups of water every day, and don't forget to drink some water before bed as well. And if you want to learn more about how to keep your kidneys healthy, check out my video, Top 5 Foods That Damage Your Kidneys. And finally, tip number 5, slightly elevate your head when sleeping to help blood flow. Using extra pillows can help reduce the risk of stroke by promoting better blood flow. By elevating your head slightly, you're helping to move blood more easily through your body, which reduces the risk of blood clots and lowers your risk of stroke. This is especially important for those who have sleep apnea or other breathing problems, as they are at a higher risk of stroke. Now, I know it might seem like a small change, but it can make a big difference. And it's easy to do. Just use 1 or 2 pillows to raise the top half of your body slightly, and you'll be good to go. All right, that's it. Those are my top 5 tips for lowering your risk of stroke. I hope these tips were helpful, and that you will incorporate them into your daily routine. Remember, stroke risk doesn't have to increase with age, especially if you know what to change. I hope this video opened your eyes to one small habit that could save your life. Now, before you go, please hit the like button, share this with someone over 60, and subscribe for more health tips. And if you have any questions or comments, please leave them below. Thanks for watching, and see you next time.